The demand for GLP-1 medications has exploded, but not all options are safe. Many patients are turning to unapproved compounded versions that could do more harm than good. Dr. Angela Fitch, the past president of the Obesity Medicine Association, joins us now. And Dr. Fitch, what are the biggest risks that patients face when using unapproved compounded GLP-1 drugs?
Michelle, thank you so much for having me, and thank you for asking that question. I think, it's important that we don't often know the risks because these medications are not FDA approved. They don't go through the same rigorous testing that medications that are FDA approved do. And so we don't know the safety, the efficacy, or, if they're stable in the delivery method that they are. And so it really can be quite harmful for patients if they don't know what they're getting.
Why is insurance coverage such a critical factor in access to obesity treatment?
Well, so obesity as a chronic disease has not been covered well by our insurance because early on it was considered to be a cosmetic issue, and not a disease. But we know now it's a true disease and it's a complex chronic disease. And so we've had some shifts recently, as you may have heard last week, where now Medicare will be covering these medications for obesity. And now that Medicare is covering it, the hope would be that commercial plans would follow and we would have standard benefit coverage for all Americans for our biggest epidemic chronic disease that we have.
So what steps should regulators and policymakers take to protect patients?
Well, I think we need much more regulation, especially around the compounding industry. It was meant to be a safe way to get patients' medications, one at a time. So one particular patient personalizing, but now they're using that personalization clause in order to mass produce and mass compound these GLP-1 medications. And we just don't feel that it is safe. We have multiple societies that have recommended against using compounded medications because of the fact that we don't know the safety, efficacy, or quality of the medication.
What can patients do to ensure they're using these safe and approved treatments?
Well, I think the most important thing is identifying a clinician who can work with you, over the long period of your life. This is a lifetime chronic disease. It's not something you can get a short-term fix. So if you're going on the internet and it seems too good to be true and you're getting social media ads for compounded things, I would stay away from that because it likely is not something that's going to be the FDA-approved, safe and effective version. I would trust a trusted medical professional. At Knownwell, where I'm the chief medical officer, we see patients 50 states virtually, including Ohio, and we have clinics across the country. So seek out an obesity care provider. You can find one at www.obesityaction.org, which is the Obesity Action Coalition.
Thank you so much for joining us today. We really appreciate it.
Thanks for having me.